The monitors flatlined at 11:47 p.m. Three of Hartwell Naval Medical Center's top surgeons stood around Admiral Raymond Voss, their gloved hands lowered, their eyes already moving toward the clock on the wall. 22 years of battlefield survival, 2 wars, 14 commendations. And now this, a man reduced to numbers on a screen that had stopped moving. "Call it," Dr. Marcus Holt said quietly. Then the door swung open. Nobody looked up. Nobody expected anything. The nurse who walked in was 29 years old, wore no rank insignia, carried a battered notebook instead of a tablet, and had spent the last 4 months being handed the jobs nobody else wanted. She crossed the room, studied the monitors, looked at the Admiral's positioning, checked the IV line they'd placed 40 minutes ago, and then she said with zero hesitation, zero apology, "You're treating the wrong injury." The room went completely still. Before this story goes any further, if you've ever believed in someone the world had already written off, this one is for you. Subscribe to this channel right now so you don't miss what happens next, because the stories we tell here don't end where you expect them to. Hit that like button and drop a comment with your city and country. I want to know how far this story has traveled. How many corners of the world are watching a forgotten woman refuse to let a man die? Let's find out together. Now, let's go back to the beginning. The rain had been falling on Carver Bay, Virginia for 6 hours straight by the time the military helicopter set down on the roof of Hartwell Naval Medical Center. It was not a scheduled landing. The duty nurse at the third-floor station, a woman named Loretta Sims, who had worked nights at Hartwell for 11 years, later said she knew something was wrong before the rotors even stopped spinning. The sound was off. Too fast, too low, the kind of descent that happens when the pilot has been told there is no margin for a normal approach. She set down her coffee and picked up the phone before anyone called her. By the time the trauma team reached the roof access, they were already behind. Admiral Raymond Voss arrived on a backboard with 2 Navy corpsmen maintaining manual compression on his left side, and a third holding an oxygen mask against his face with both hands. He was 61 years old, barrel-chested, with the kind of face that had been weathered by decades of wind and salt air rather than age. Under normal circumstances, the Admiral was the sort of man who filled a room just by standing in the doorway. Tonight he was unconscious, his color wrong, his breathing shallow and uneven in a way that made the receiving team exchange a look over his body before anyone said a word. "What happened?" Dr. Marcus Holt demanded, already moving alongside the gurney as it came through the doors. "Classified helicopter incident, 40 miles offshore," one of the corpsmen said. His uniform was soaked through. He was responsive for the first 8 minutes, stopped talking around the 20-minute mark. No visible head trauma, no obvious fractures on preliminary assessment. Vitals? BP was 90/60 when we loaded him, dropped to 84/58 en route. Heart rate's irregular. Not sustained arrhythmia, just inconsistent. Holt didn't like that word. Inconsistent meant the corpsman didn't know how to describe what he was seeing, which meant the presentation was unusual enough to resist easy categorization. He pushed through the trauma bay doors and called out orders without breaking stride. 2 large-bore IVs, type and cross, CT of chest and abdomen, cardiology on standby, neuroconsult now. The room organized itself around his voice. It always did. Marcus Holt had been chief of trauma surgery at Hartwell Naval Medical Center for 9 years, and before that he'd spent 6 years at a Level 1 trauma center in Baltimore that took the worst of what the city had to offer on any given Friday night. He was not a man who panicked. He was not a man who second-guessed. He assessed, he decided, he acted, and the people around him followed because he moved with the absolute certainty of someone who had been right enough times to stop doubting himself in the critical moments. That certainty was, under the right circumstances, a liability. He didn't know that yet. The trauma bay filled with personnel, residents, nurses, a respiratory tech, a pharmacist who'd been paged from the floor above. The monitoring equipment beeped to life around the Admiral's body. Someone cut his uniform away with trauma shears while someone else secured the airway. The room had the particular focused chaos of a place where everyone had a job and everyone was doing it, and the accumulated noise of equipment and voices and movement created a kind of pressure that either clarified thinking or compressed it. In the far corner of the trauma bay, near the supply cart, a nurse named Mara Osei stood and watched. She had been on the floor when the alert came through, restocking the IV supplies that the day shift had burned through and failed to replace. A task she'd been handed because she was the newest addition to the night rotation, and the senior nurses had decided, collectively and without much discussion, that new people earned the unglamorous work before they earned anything else. She was 29. She had been at Hartwell for 4 months. She had a calm face, watchful eyes, and a habit of standing very still in busy rooms that some people read as uncertainty, and others, if they were paying closer attention, might have read as something entirely different. She was not invited into the circle around Admiral Voss. She wasn't told to leave either. There were too many people moving too fast for anyone to notice she was there. So she stayed where she was, and she watched, and she listened, and she turned the observations over in her mind with the quiet efficiency of someone who had spent years training herself to read a patient's body faster than the patient could communicate what was wrong. The CT results came back in 22 minutes. Holt pulled them up on the wall screen and studied them alongside Dr. Priya Nalini, the senior resident who had been first on scene, and Dr. James Reed, the cardiologist who'd arrived red-faced and slightly winded from a floor he'd had to walk because the elevator was in use. Internal bleeding, Holt said. Left lower quadrant. Looks like splenic involvement. That's our primary. Heart's showing some irregularity on the echo, Rede said, leaning toward the screen. Could be stress response. Could be something more. Could be both, Nalini offered. We go after the bleeding first, Holt said. It wasn't a suggestion. Get me an OR. Mara Osei, in the corner, was looking at something else entirely. She was looking at the Admiral's hands. They were resting at his sides, and the way they were positioned, slightly curled, the fingers not fully relaxed, was familiar to her in a way she couldn't immediately explain through the language of civilian medicine. She had seen hands like that before, in other rooms, in other places, in circumstances she had stopped discussing with people who hadn't been there. The curl wasn't pain response. It wasn't comatose limpness. It was something in between, and the specific quality of the in-between was what was turning a cold, careful alarm over in her chest. She moved a step closer without meaning to. Can someone explain why his temperature is 96.4? She asked. Nobody answered. The room was moving. His core temp, she said slightly louder. It's low. Not hypothermia low, but lower than it should be given his other vitals. Combined with the irregular heart rhythm and the inconsistent BP. Nurse. Nalini turned around. She was 27 years old, in her 3rd year of residency, and she had the clipped, efficient manner of someone who had been told since medical school that she needed to project authority to be taken seriously. She projected it now. We have the imaging. We have a clear source of hemorrhage. Please focus on your assignment. I'm not disputing the bleeding, Mara said, but the vital pattern doesn't match isolated splenic trauma. The temperature drop, the rhythm, the way his hands are positioned. His hands, Reda repeated, and the way he said it made 2 of the other nurses in the room look away to hide their expressions. Neurological withdrawal response, Mara said evenly. Autonomic. I've seen it in... She stopped herself. It can present alongside trauma, but it's a separate process. If you go into surgery without addressing it, you might stabilize the bleed and still lose him. Holt turned around for the first time since she'd started speaking. He looked at her the way people look at background noise that has gotten loud enough to require acknowledgement without yet requiring engagement. A brief, assessing glance that took in her scrubs, her position near the supply cart, the absence of any designation on her badge beyond her name, and the word nurse. What's your name? He asked. Osei. Mara Osei. How long have you been at Hartwell? She knew where this was going. 4 months. 4 months. He nodded once, not unkindly, the way a man nods when he's confirmed something he already knew. We appreciate the observation, but we have imaging, we have vitals trending in a consistent direction, and we have a patient who needs a surgeon, not a theory. Get me that OR. That last sentence was not directed at her. The team moved. The Admiral's gurney was unlocked and prepared for transfer. Mara stood where she was, watching his face, watching the monitors, watching the particular rhythm of his breathing that the ventilator was now supporting, and the wrongness of it stayed in her chest like something with weight, pressing. She reached out and put 2 fingers against the inside of his left wrist, just below the IV line. Not checking pulse. She could see the pulse on the monitor. Checking something else. The temperature of the skin. The quality of the tension in the muscle beneath. Her eyes went to the monitor. then back to his wrist, then to the monitor again. The OR team arrived to transport. She stepped back. She let them go. She stood alone in the trauma bay while the sound of the gurney's wheels faded down the corridor, and she pressed her back against the supply cart and breathed through her nose and made herself think clearly. The surgery would find the bleeding and address it. Holt was good enough to do that cleanly. The question was whether the bleeding was the whole story or just the loudest part of a story with several chapters, and what happened to the chapters nobody was reading while everyone focused on the loud one. She picked up her notebook, actual paper, spiral-bound, something else the other nurses found faintly eccentric, and began writing down everything she'd observed. Time-stamped. Precise. The kind of documentation that turned a hunch into a record. The night charge nurse, a heavy-set man named Dennis Quill, who had been at Hartwell longer than Holt and trusted no one who hadn't earned it, found her there 10 minutes later. "You're not supposed to be in here anymore," he said, not unkindly. "I know. Holt already has a plan. I know that too." Quill looked at the notebook in her hand and then at her face. He was 62 years old and had spent most of those years learning to read people. And what he read on Mara Osei's face was not arrogance or naivety or the particular brand of overconfidence that sometimes infected nurses who'd read one too many case studies. What he read was something quieter and harder to name. "What are you thinking?" he asked, despite himself. "I'm thinking," she said carefully, "that his autonomic nervous system is doing something deliberate, not failing, pulling back on purpose. And I'm thinking that when a body does that, it's usually because it's trying to protect something specific." "What something?" "That's what I don't know yet." Quill was quiet for a moment. Then, "You don't have privileges to do anything on your own." "I know. And if Holt comes out of that OR in 2 hours with a successful bleed repair and a stable patient, you're going to look like you caused a disruption for nothing." Also aware. He studied her for another second. "Write everything down. Everything. Time-stamped." "Already doing that." He nodded and walked away without saying anything else. Mara went back to her notebook. Surgery took 3 hours and 40 minutes. She spent that time doing her actual job, her assigned patients, her documentation, her rounds, because the Admiral was not her patient in any official sense, and there was nothing she could do for him while he was on a table in OR 2. She changed a dressing on a post-op knee replacement in room 14. She adjusted the IV rate on a patient in room 19 who had been running a slight fever since afternoon. She sat with a 22-year-old seaman named Torres for 11 minutes because he was scared and had been asking questions that the night team kept answering with efficient dismissal. And she had always found that scared patients needed about 11 minutes of actual attention before they could sleep. Torres was asleep by the time she left. She was at the nursing station when the word came down that the surgery had gone well. Holt emerged from the OR at 3:14 a.m., scrubbed out, unhelmeted. He spoke to the 2 Navy officers who had been waiting in the family consultation room since just after midnight. She could see them through the window from the nursing station. Their posture, the way they listened, the small, precise nods of people trained to absorb information without reacting to it. Holt's body language was confident. The bleed was controlled. The spleen had been partially resected. The Admiral was in recovery. He did not stop at the nursing station. He did not look for Mara Osei. She didn't expect him to. She went back to room 19 and checked the fever patient again. At 4:47 a.m., the ICU paged a rapid response. She was already moving before she fully understood why. Something in the tone of the overhead, something in the pattern of the alert, pulled her body into motion ahead of conscious thought. She hit the stairwell because the elevator was 30 seconds she didn't want to spend. The ICU was on 4. She came through the door at a run and stopped. The room was already crowded. Holt was there, recalling from home or from sleep, his hair not quite right, his shirt collar open. Nalini was there. The night ICU team. 2 of the Navy officers from downstairs standing back against the wall with the rigid stillness of people who understand that they're in the way but cannot make themselves leave. And in bed 3, connected to equipment that was now screaming in an uneven, syncopated alarm that Mara had heard before in a different context, in a different life, was Admiral Raymond Voss. His BP had crashed to 62/40. His heart rate was 41 and dropping. The post-surgical site was stable, no secondary bleed, nothing on the quick sonography they'd run 2 minutes earlier. The bleed was not the problem. "Epi, 2 milligrams, Holt was saying. "Get me a crash cart." Mara came to the foot of the bed. She looked at his hands. They were the same specific curl, tighter now. She looked at his skin. At the temperature differential she could see in the modeling of his color. Not uniform, not the gray of general cardiovascular collapse, but patterned. Specific areas of his face and neck showing differently than his chest. She looked at the particular way his body was positioned, the slight unconscious lean to the left that nobody had noticed or noted because it looked like nothing. And she knew. Not thought, not suspected. Knew. The way she had learned to know things in places where the cost of being wrong was measured in bodies. "Stop," she said. Nobody heard her. Or nobody chose to hear her, which was not the same thing but produced the same result. "Stop the epinephrine," she said, louder. Holt turned around. "Osei." His voice had an edge now. "This is an ICU emergency. I need you to step back." "The epi will accelerate the cascade," she said. "His nervous system is in deliberate suppression. If you push stimulants into a deliberate suppression response, you're not going to restart the process. You're going to fight it. You'll win for about 90 seconds, and then his body will push back harder than it did the first time, and you won't have anything left to counter with." "What cascade?" Nalini said. "He's in cardiovascular." "He's not." Mara stepped closer. "Look at the modeling. Look at the distribution. It's dermatomal. That's not cardiovascular collapse. That's neurological withdrawal. Autonomic storm pulling circulation away from peripheral areas in a specific pattern. His body is protecting his core, his brain. It's not shutting down, it's barricading." Silence. Not agreement, not acceptance. Just the particular silence of a room full of people encountering a claim that is strange enough to create a pause. Holt's jaw tightened. "Osei, 1 minute," she said. "Give me 1 minute to show you the dermatomal pattern. And if I'm wrong, you can proceed with EPI, and I'll leave the floor and never raise another question in this hospital again. 1 minute." Something in the room shifted. She felt it without being able to name it precisely. The specific temperature change of a situation that has arrived at a pivot point. It was not Holt who spoke next. It was one of the Navy officers, a broad-shouldered man in his 50s who had been standing against the wall so still that she had almost stopped seeing him. He had iron gray hair and the face of someone who had made decisions in difficult conditions for long enough that difficulty no longer registered as stress, only as input. He stepped forward 2 paces. He looked at Mara Osei, and his face changed. It was subtle, not dramatic, not the kind of recognition that announces itself. A small recalibration behind the eyes. A stillness that replaced the previous stillness in a way that made them different stillnesses entirely. "Let her look," he said. It was not a request. It was not loud. It had the particular quality of a sentence that doesn't need volume because volume is not the source of its authority. Holt turned to look at him. "Admiral's orders put me in clinical authority, and I'm outranking that authority in this room right now," the officer said. "Let her look." The crash cart had been wheeled in. The epinephrine was drawn. Nobody pushed it. Mara moved to the Admiral's side and began, quickly, precisely, without wasted motion, walking the team through what she was seeing. Skin mapping, temperature differential, the specific distribution of the modeling, the position of the hands, the breathing pattern underneath the ventilator support, the way his eyes were moving, faintly, barely, but moving, beneath closed lids in a pattern that was not RM and not coma, but something that had a name she'd learned in a field manual she was not supposed to have read. She spoke clearly and without jargon because jargon in a crisis slowed people down. The ICU team listened. Some of them understood immediately. Some of them followed the chain of reasoning without being able to verify it. One resident in the back of the room pulled out his phone and started cross-referencing, which she noted and appreciated. Holt stood with his arms crossed and his face unreadable. When she finished, the Navy officer said, "What do you need?" "No epinephrine. Specific temperature protocol. Passive warming only, no active. Position change, 30-degree tilt. And a neurologist, not the on-call consult, but someone who specializes in dysautonomia." "We have a dysautonomia specialist on staff?" "Dr. Femi Adeyemi. She's in research. She doesn't take clinical cases normally, but—" "Get her," the officer said. "To the room, not to anyone specific." Nalini picked up the phone. Holt had not moved. He was looking at Mara with an expression she couldn't fully decode. Not anger, not precisely. Something more complicated. The expression of a person who has just been shown a gap in their own certainty and has not yet decided how to respond to the discovery. "If you're wrong," he said, "and his pressure doesn't stabilize in the next 10 minutes without intervention, then you have everything you need already drawn up," she said. "I'm not asking you to wait long. Just don't push the epi before we have Adeyemi's eyes on him." She turned back to the Admiral, and as she adjusted the bed angle herself, because the tech who should have done it was still standing frozen by the door, she caught, just barely, at the edge of what was probably imagination but felt like more, a change in the quality of the tension in his hands. The curl loosened, fractionally. The way something loosens when the thing it was bracing against changes. She kept her face neutral. Behind her, the monitors kept screaming, and in the corner of the ICU, the Navy officer who had told a room full of doctors to listen to a nurse, nobody knew was watching her work with the specific attentiveness of a man who had not seen something in a very long time and had just unexpectedly seen it again. The Admiral's blood pressure read 68/43. It was not stable. It was not good, but it had not dropped further in the 90 seconds since she'd changed the bed position. The monitors continued their alarm, and outside the ICU windows the rain kept falling on Carver Bay, and somewhere on the floor below, a 22-year-old seaman named Torres slept without knowing any of this was happening, and Mara Osei stood at the bedside of a man she had never met and held very still and waited for the next number to appear on the screen. 68/43 became 71/46, became 74/49. Nobody announced it. Nobody celebrated. The numbers just climbed in small, reluctant increments over the course of 19 minutes, the way a tide comes in. Without drama, without asking permission, simply moving in the direction it intended to move all along. The crash cart stayed where it was. The epinephrine stayed in the syringe. The ICU team stood in the particular suspended state of people who have prepared for one outcome and are being asked, in real time, to accommodate the possibility of another. Mara kept her position at the bedside. She adjusted the warming blanket twice, not because the protocol required it at those intervals, but because the Admiral's skin temperature at his right shoulder was lagging behind the rest of his trunk, and the differential bothered her in a way she couldn't fully justify through numbers alone. She checked his pupils every 4 minutes. She logged everything in her notebook before entering it into the system, because paper didn't crash and paper didn't have a 15-second lag, and paper was there when she needed to look at 3 data points simultaneously without navigating between screens. Dr. Femi Adeyemi arrived at 5:19 a.m. She was 53 years old, small and sharp-featured, with close-cropped natural hair and the unhurried manner of someone who had long ago stopped performing urgency for other people's comfort. She had come from her home 12 minutes away, which meant she had driven fast, but she walked into the ICU as if she had all the time available to her that she needed. She carried her own bag. She did not look around for someone to brief her. She went directly to the bedside, looked at the monitors, looked at the patient, looked at Mara. "You called this in?" she said. "I flagged the presentation. The Navy officer requested you specifically." "Based on what?" "Dermatomal modeling, asymmetric temperature distribution, position-responsive pressure change, autonomic withdrawal pattern, not cardiovascular collapse." Adeyemi was already looking at the Admiral's skin. She didn't respond immediately. She put on gloves, did her own assessment, thorough, efficient, completely unself-conscious about the fact that she was conducting it with an audience of 12 people who were all trying to interpret her expression and getting nothing useful from it. 2 minutes later, she straightened and said, without turning around, "She's right." The words landed in the room with an odd weight. Not loud, not emphatic, just accurate in the way that accurate things sometimes are, with the particular density of a fact that has been established. Holt said, "Femi, his autonomic nervous system is in active protective suppression," Adeyemi said, turning now. This is not an uncommon response to a specific category of neurotrauma that is easily missed in standard trauma assessment because it doesn't show up clearly on imaging and it mimics cardiovascular instability closely enough that the differential gets skipped. The intervention you were about to administer would have been not ideal. She was being diplomatic. Mara appreciated it. Holt, she thought, probably did not. "Treatment?" the Navy officer said. "She's already started it," Adeyemi said. "The positioning change, the passive warming protocol. I'd add a low-dose magnesium infusion and request continuous neuromonitoring rather than standard interval checks. He needs someone watching this in real time, not on a 40-minute cycle. And prognosis? Adeyemi paused. It was the first time she'd paused. Cautiously favorable, if the underlying cause is what I think it is. But I need more information about the mechanism of his injury, the incident that brought him in, approximately 4 hours before the crash. Something shifted in Adeyemi's expression. Not surprise, exactly. More like the specific quality of attention that activates when information meets a prior expectation and confirms it. You flagged it then? I tried to. The team was focused on the imaging findings. Adeyemi looked at her for a moment in the appraising but not unkind way she might look at an unusual result. Where did you train? It was a reasonable question. It was the question Mara had been managing in various forms for 4 months, deflecting, redirecting, answering with just enough to satisfy the surface of the inquiry without disturbing anything underneath. Army Medical Corps, she said, then Civilian Nursing Program. Army Medical Corps doesn't teach DICE autonomia recognition at this level. No, Mara agreed. It doesn't. Adeyemi waited. Mara didn't fill the silence, and after a moment, Adeyemi turned back to the patient and began writing her orders. The conversation was closed, or at least set aside, and Mara recognized the particular quality of the closing. Not satisfied, just deferred. By 6 a.m., the Admiral's pressure had climbed to 91/58, and his heart rate had stabilized at 67. Not normal, not out of the woods, but moving in a direction that had, 2 hours earlier, seemed improbable enough that the crash cart had been positioned for immediate use. Adeyemi had set up the monitoring protocol and handed off to the day ICU team with specific instructions. The Navy officers had taken a brief call, the contents of which Mara wasn't privy to, and then resumed their positions in the corridor outside the ICU. Not inside, not visibly attending to the room, just present in the way that certain people are present when the thing they're guarding requires presence without announcement. Mara's shift ended at 7. She sat in the break room for 6 minutes, ate half a granola bar that had been in her locker for 3 days and tasted like it, and wrote the last of her overnight notes. Her handwriting was very small and very precise, not neat exactly, because neat implied care for appearance, and her handwriting was not about appearance. It was about information density, how much you could fit on a page without losing clarity. Dennis Quill found her there. "You should know," he said, setting a cup of coffee on the table that she hadn't asked for but accepted without comment, "that Holt is filing a formal incident report, unauthorized interference in an active emergency response." Mara looked up from her notebook. "Okay. That's it? Okay? What else should I say?" Quill sat down across from her, which was not something he usually did. He was a man who delivered information standing up and left before you could ask follow-up questions. The sitting was unusual enough that she paid attention to it. "You should probably say something to someone before it gets filed," he said. "About your background, about how you knew what you knew." "My background is in my HR file." "Your HR file says Army Medical Corps, 4 years, honorable discharge. It says Civilian Nursing Program. It does not say anything that would explain tonight." Mara put down her pen. "I'm not in a position to explain tonight," she said carefully. "The documentation I made is accurate. The clinical reasoning is verifiable." Adeyemi confirmed it. "The outcome supports the approach. That should be enough for the incident report." "For the incident report, maybe." Quill wrapped his hands around his own coffee. "Holt's pride is going to want more than that." She didn't answer right away. She looked at the table, at the granola bar wrapper, at the specific nothing of a surface she was using to think against. The problem with the truth was that it was not simple, and the pieces of it that were medically relevant were tangled up with pieces that were not hers to put on a table in a hospital break room. She had spent 4 years learning how to navigate that tangle without cutting through it, because cutting through it had consequences she wasn't prepared to revisit. "Tell him to look at the outcome," she said finally. "The Admiral is alive and stabilizing. That's what the report should center on." Quill looked at her for a long moment. Then he picked up his coffee and stood. "Day shift wants you back tonight. They don't usually ask for specific nurses, so." He left without saying anything else. She finished her notes, put the notebook in her bag, and took the stairs down to the parking structure, and she sat in her car in the gray early morning light for a while without starting it. The rain had stopped somewhere around 5 a.m., and the world outside was the specific washed-out color of a coast after a storm, clean in the way that isn't quite beautiful, just emptied out, the air carrying a saltwater cold that you felt in the joints more than on the skin. She had a studio apartment 12 minutes from the hospital. She had a cat named Kip, who was almost certainly asleep on the kitchen counter, despite the fact that she had explained to him multiple times that the counter was not for sleeping on. She had a small collection of books, mostly technical, with a few novels mixed in that she'd bought secondhand and read twice each, and a habit of making tea in the evenings that she had maintained as a kind of anchor to the version of daily life she was trying to build. She had not intended to do what she had done tonight. She had intended, as she had intended every night for 4 months, to do her job quietly, competently, and without drawing the kind of attention that pulled at threads she had worked very deliberately to tuck away. She had intended to be unremarkable, to be the new nurse, to let the other nurses hand her the IV restocking and the difficult patients and the night shift tasks nobody wanted, and to do those things well enough that she earned a slow and gradual credibility that never required anyone to look too closely at where it came from. She had not intended to walk into an ICU at 4:45 in the morning and tell a room full of doctors and Navy officers to stop what they were doing. But the Admiral's hands had been positioned exactly the way the hands of a soldier named Dominguez had been positioned 8 years ago in a forward operating base outside Kandahar when nobody could figure out why he kept crashing on the table despite a clean surgical repair, and Mara had been the one to recognize it then too. And in that case, she had not spoken up fast enough, and Dominguez had spent 6 days in a coma that he had not fully deserved to survive. She had not made the same mistake twice. She started the car and drove home. She slept 4 hours. She dreamed about nothing she could remember afterward. She woke at noon to Kip sitting on her face, which was his preferred technique when the food bowl was empty. And she fed him and made tea and stood at the window and looked at the water. Her phone had 3 messages. One from a number she didn't recognize, one from the hospital scheduling system confirming her return shift, and one from Dennis Quill that said only, "Call me when you're up." She called Quill. "The Navy officers are still at the hospital," he said. "The senior one, Commander Reyes, has been asking about you." She absorbed that. Asking what? Asking about your background. Your record. He was very specific about it, not just asking the front desk kind of question. He had your full name, and he wanted to know who your supervising charge nurse was, and whether you'd had any formal complaints filed. Had I? No, you'd had a commendation from Room 19's attending for patient management, which I don't think he expected to hear based on his face. A brief pause. Mara, he recognized you. She was quiet. I don't know from where, Quill continued. He didn't say, but the way he was asking, it wasn't a background check, it was a confirmation. She set down her tea. What did you tell him? That you were a good nurse and a careful one, and that your HR file was available through the proper channels, which it is. Thank you, Dennis. You want to tell me what's in the parts that aren't in the HR file? No, she said honestly. Not yet. He sighed. Not frustrated, just tired in the way of a man who has accepted that some information comes on its own schedule. Get some more sleep. You're back at 7. She returned to the hospital at 6:40, 20 minutes early, which was her habit. She changed into fresh scrubs, checked in with the outgoing evening charge, and went to look at the board. The ICU updates were visible from the 4th floor station. The Admiral had been moved from critical to serious. His pressure was holding. Adeyemi had visited twice during the day and left notes in the chart that Mara read carefully, checking her own assessments against the specialist's language, finding the places where they converged, and the one place, a secondary notation about reflex response latency, where Adeyemi had identified something she had not. She noted it in her own record and moved on. The evening was quiet in the way that hospital evenings sometimes are after a violent night, a collective drawing of breath, a settling. She did her rounds, she managed her patients. She was professional and present, and she did not go to the 4th floor except when her duties took her there, and she did not seek out Commander Reyes or Dr. Adeyemi or anyone else involved in the Admiral's case. She was changing a dressing in room 22 at 8:40 p.m. when she heard the overhead. Code Gray, ICU, 4th floor. Code Gray, 4th floor. Code Gray was not a medical emergency. Code Gray was a security event. She finished the dressing. She taped it correctly. She told the patient in room 22 that everything was fine and that she'd be back to check on him in an hour. Then she walked to the stairwell. The fourth-floor corridor outside the ICU was not empty. It had more people in it than a code gray typically generated. Not just the security team and the nursing supervisor, but 4 men in civilian clothes who carried themselves with the particular combination of stillness and readiness that she recognized as federal or military adjacent or both. The ICU doors were closed. The ward clerk at the exterior desk was speaking to someone on the phone with the careful, deliberate tone of a person who has been told exactly what to say. She was 3 feet from the unit when Nalini appeared in the ICU doorway. The resident's expression was different from what it had been at 5 in the morning. At 5 in the morning, she had been clipped and authoritative and slightly dismissive. Now she looked like someone who had been carrying a heavy thing for a while and was trying not to show how heavy it was. She saw Mara and for a moment seemed to be deciding something. Then she stepped into the corridor and let the door close behind her. "What happened?" Mara said. "Someone accessed the Admiral's medical records, twice, during the shift change when the system was in transition mode and the dual authentication was briefly suspended." "Who?" Nalini shook her head, not refusing to answer, but genuinely not knowing. "IT flagged it about 20 minutes ago. The access wasn't from a clinical terminal. It was from an administrative login." Mara felt something cold move through her chest. Not surprised. The surprise was somewhere behind the cold, still catching up. What was accessed? His medication chart, his neurological protocol notes, the treatment orders from this morning. Nalini paused. And the admitting paperwork, including his transport origin and the documented nature of the incident that brought him in. "The classified incident," Mara said. "Yes." They stood in the corridor while one of the men in civilian clothing moved past them without acknowledgement, his attention entirely on the phone in his hand, his pace brisk and deliberate. "Commander Reyes knows?" Mara asked. "He's the one who requested the code gray." Mara looked at the closed ICU doors, at the Admiral, on the other side of them, at the particular shape of a situation that had been medical an hour ago and had now become something else. Something with edges that she recognized from a part of her history she had been trying, for 4 years, to keep in a locked room at the back of her mind. "Is anyone adjusting his monitoring in response to the breach?" she asked. Nalini blinked. "What do you mean?" "If someone accessed his medication chart and his neurological protocol, they now know exactly what's being administered and at what intervals. They know the treatment parameters. If someone wanted to interfere with his care, they'd know precisely where the windows are." The hallway felt different after she said it. Not louder, quieter, actually. The specific quality of quiet that comes when a room has just processed a thought that changes the shape of everything around it. Nalini turned without a word and went back through the ICU doors. Mara followed. She was not supposed to be in there. The code gray had effectively restricted access. The ICU charge nurse, a woman named Yolanda Ferris, who ran the night shift with a tight and well-earned precision, looked up when Mara came through and started to say something. Commander Reyes was at the Admiral's bedside. He turned when the doors opened. His eyes went to Mara. The expression on his face was the same recalibration she had seen at 5 in the morning, but it was faster now and more settled. The expression of a man who has been moving toward a conclusion and has just arrived at it. "Osei," he said. "Commander." She kept her voice even. "If someone accessed his chart, you need to verify the physical security on his IV lines and his monitoring leads. Not because tampering is confirmed, but because if someone had the capability and the motive to access his records remotely, the physical access point is the next logical step." "We've thought of that." "Has anyone checked the magnesium infusion line?" she asked. "Specifically, it was added after the initial orders were placed, and it's not on the primary alert monitoring. It would take approximately 45 seconds to alter the concentration without triggering an alarm." Reyes looked at her steadily. "How do you know that?" "Because I helped set up the protocol, and I know where the gaps are," she said. "Check the line." One of the civilian-clothed men moved to the IV setup without waiting for Reyes to give the order, which told her something about who he was and who he worked for. She watched him check the line, the junction, the seal, the drip rate, the bag itself, with the practiced efficiency of someone who had checked things like this before in contexts that were not clinical. He straightened. "It's been adjusted," he said. "The concentration is wrong. Someone bumped it up." The room went very still. Not the stillness of uncertainty this time. The stillness of a threshold that has just been crossed, after which nothing is the same as it was on the other side. Mara was already at the bedside, already checking the rate, already calculating what had gone in versus what should have, and over what window of time. "How long has this been running at the wrong concentration?" Reyes said. "Less than 40 minutes based on the bag volume," Mara said. "But I need to know exactly when it was last documented by the nursing staff, and I need the current magnesium level." "I'll call the lab," Nalini said. "Now," Mara said, not harshly, just clearly. Nalini went. Reyes stepped to her side, close enough to speak quietly. "How serious?" "Depends on where his baseline is and how fast the infusion has been running. Too much magnesium suppresses the cardiac conduction system. In someone whose autonomic nervous system is already in a protective withdrawal state." She checked the Admiral's most recent vital sign entry on the monitor. "It could look like natural deterioration of his existing condition. It could look like he just got worse on his own." "Yes," she said. "Exactly like that." Reyes was quiet for 3 seconds. Then, "Someone in this hospital did this. Someone with physical access to this floor and enough knowledge of the protocol to know which line to alter." She stepped back from the bedside to give the man with the civilian clearance room to document the IV setup, and enough knowledge of his case to know that the adjustment would be attributed to neurological decline rather than external interference. "That's not a random employee," Reyes said. "No," she agreed. "It's not." She looked up from the Admiral's chart. On the other side of the ICU glass, visible through the interior window that looked out to the nursing station, a figure was moving away down the corridor with a pace that was a half step too fast. She registered it the way she registered most things in motion, automatically, categorically, filed before she consciously decided to file it. She recognized the gait. She had been seeing it for 4 months, in the hospital corridors, at the nursing station, in the cafeteria at odd hours. It belonged to someone whose name she had known since her second week at Hartwell, someone who occupied a position that gave them access to the administrative systems and the clinical floors and the kind of mid-level institutional invisibility that let a person move through a building without anyone tracking the pattern of their movements. Her throat tightened, not with fear, with the specific, cold, concentrated feeling of a puzzle that has just produced its final piece, unexpectedly, in a way that makes the completed picture worse than the incomplete one had been. "Commander," she said. Reyes looked where she was looking. The corridor outside the ICU was empty. "Who was just out there?" she said. Reyes turned to the security panel by the door, which had a camera feed. He pulled it up. He studied it. And then his jaw set in a particular way, tight at the back, the muscles of his face doing the work of keeping his expression professional while something harder moved behind his eyes. He reached for his radio. And Mara stood at the Admiral's bedside, watching the vital signs that were, for now, holding steady, and understood that the thing she had walked into tonight was not finished, that it had in fact barely started, and that the quiet life she had been building in Carver Bay for 4 months had just been, without her permission and without warning, fundamentally changed. Reyes had his radio to his mouth for 4 seconds before he put it back down. It was the kind of decision that happened faster than its consequences could be calculated. The moment where instinct outpaces procedure, where a man who has spent decades in operational environments recognizes that announcing the pursuit changes the pursuit. He looked at the empty corridor on the camera feed for another 2 seconds, then turned to the younger officer, the one who had barely spoken all night, whose name Mara still didn't know, and said one word. "Corridor B." The younger officer was already moving. Reyes turned back to the ICU, to the room, to the specific tactical problem of a patient who had just been interfered with in a way that was designed to look like nothing. "What do you need to stabilize him?" he asked Mara. "I need to run the numbers on what he's already absorbed and adjust accordingly. And I need whoever is supposed to be monitoring this line to tell me exactly when they last physically checked it." She looked at Yolanda Ferris, the night charge. Ferris was a careful woman, and careful women did not enjoy being put in the position of answering for a gap they didn't create. "My last documented check was 22:30, she said. "That's 43 minutes ago. Who else had access to this room in that window?" "My team. The physician on call did a check-in at 22:15 and left. Adiemi's fellow stopped by to pull the neurolog at approximately 22:40. She paused. And the administrative supervisor did a floor walk, routine. He does it every Tuesday. Name, Reyes said. Garrett Poole. He's the Associate Director of Clinical Operations. He's been here 9 years. The name sat in the room without being directly responded to, but Mara watched Reyes register it, and she could tell from the quality of his stillness that it was not the first time tonight he had heard it. She turned back to the Admiral's chart and began working through the calculation. The infusion rate, the documented concentration versus actual, the window of exposure, the Admiral's current body weight, as recorded in the surgical notes, his renal function from the last labs. The math was not complicated, but it required precision, and she did it twice before she committed to a number. He's absorbed enough to be a concern, but not enough to be in crisis territory yet, she said. His cardiac conduction is showing slight prolongation on the QT interval. It's within range right now, but it's moving in the wrong direction. I want to discontinue the magnesium infusion, run a corrective calcium gluconate push at a conservative rate to buffer the effect, and recheck labs in 30 minutes. That's outside your scope, Ferris said. Not aggressively, factually. Get Adeyemi on the phone, Mara said. She can authorize it. Ferris went for the phone. Nalini had returned with a lab result printout and handed it to Mara, who looked at it, looked at her own calculation, and felt the particular relief of numbers that match. Not because matching is good news exactly, but because it means you're working from accurate premises. Adeyemi answered on the second ring despite the fact that it was after 9 p.m., and Mara gave her the numbers without preamble and listened to the brief silence on the other end that meant the specialist was running her own mental calculation. Do it, Adeyemi said. Conservative rate, exactly as you described. I'll be there in 20 minutes. Nalini pulled the order set up on the terminal. The calcium gluconate was drawn. Mara administered it herself, at the rate she'd specified, with her eyes on the monitor the entire time. The QT interval didn't improve in the first 5 minutes. It didn't worsen either, which was the more immediate concern. She stood at the bedside and watched it the way she had learned to watch things, not with the white-knuckled attention of someone waiting for disaster, but with the settled, functional alertness of someone who has been in enough situations where things go wrong to have made a kind of peace with the uncertainty of whether they will. The Admiral's face was still. He had not regained consciousness since the helicopter. Whatever was happening behind his closed eyelids was happening in a place nobody in this room could access directly, and Mara thought about that briefly, about the strange isolation of being unconscious in a room full of people fighting for you, unable to know it. And then she set the thought aside because there was nothing useful she could do with it, and there was plenty useful she could do with the things in front of her. Reyes came back into the ICU 11 minutes after the younger officer had left. His expression told her something before he spoke, and what it told her was not good news, but it was conclusive news, which was a different category. Puel left the building, he said. He badged out at 22:51. Security has his vehicle on camera leaving the parking structure. He didn't work the full administrative shift? Ferris asked. He told the front desk he had a family emergency. Reyes looked at the monitor above the Admiral's bed. How is he? Holding, Mara said. QT is stable for the last 6 minutes. The access logs on his medical records. EAT is pulling the complete picture now. We'll know within the hour what was viewed, when, from which terminal, and whether there were any external transmissions. Reyes stopped beside her. This isn't the first time someone has tried to reach him. She looked up from the monitor. The helicopter incident wasn't an accident, he said. We've known that since about 4 hours after it happened. What we didn't know was whether the continuation of it would follow him here. He paused. It did. Someone coordinated with someone inside this hospital, she said. That's what it looks like. She thought about the 9 years Garrett Poole had reportedly spent at Hartwell Naval Medical Center. 9 years of floor walks, of administrative access, of the particular institutional trust that accumulates in a person who is present and competent and unremarkable over a long enough period that people stop asking what they're doing and simply accept that they belong. It was a patient kind of operation, the kind that didn't get built overnight, which meant either Poole had been placed here deliberately in anticipation of a need that hadn't yet arisen, or he had been turned at some point during those 9 years by someone who identified his leverage point and applied pressure to it. Both possibilities were unpleasant. The second was more common. He'll have a contact, she said. Yes. And he'll either run to them or they'll cut him loose, depending on how they operate. Reyes nodded. My people are on it. He looked at her with the expression he'd been carrying since the early morning, the one that was confirmation wearing the clothes of assessment. Osei, I need to ask you something directly. I know, she said. How do you know? She looked at the Admiral, at the monitors, at the specific hard-won stability of a man who had almost been unmade twice in the same night through two completely different methods. Because you recognized me, she said, in the ICU this morning, and you didn't say anything about it until now, which means you weren't sure, or you needed to see how I handled the situation before you decided what to do with what you knew. Reyes was quiet for a moment. Fort Kellerman, he said. The name landed behind her sternum like something physical. She breathed through it. Yes. Operation Sandline. I'm not going to confirm operational details in an unsecured clinical environment. No, he said. You're right. But I need you to understand that what I know from Fort Kellerman and what you've demonstrated in this room in the last 18 hours are talking to each other in a way that I think is relevant to what's happening to the Admiral right now. She turned to look at him directly. Say what you mean. The people who tried to kill him, the helicopter wasn't random. He was targeted because of testimony he is scheduled to give in 72 hours before a federal oversight panel. Classified acquisition irregularities going back 8 years. The people implicated have resources and reach, and what happened tonight suggests they have reach into this facility specifically. He paused. We came here to secure him, but we didn't anticipate an internal asset. We're now in a situation where the medical team treating him needs to be assessed, the facility's internal security needs to be treated as compromised, and his clinical care needs to continue without interruption. That's a complicated set of requirements to meet simultaneously. Yes, he said. It is. She understood what he was not saying directly, which was that he needed someone who could operate across those requirements, who could function in the clinical space with the credibility she had already established while understanding the security dimension well enough not to create gaps in it. Someone who was neither purely medical nor purely operational, but occupied an unusual intersection of both. Someone, in other words, like the person she had spent 4 years trying not to be. My classification status lapsed when I separated, she said. I can have it reinstated within the hour. She looked at the Admiral one more time, at the QT interval that had, in the last 12 minutes, quietly moved back to within normal range. Let's get through the next 30 minutes first, she said. Adeyemi arrived at 21:42, reviewed the chart, reviewed Mara's intervention notes, and said nothing for a moment that lasted long enough to be meaningful. The calcium gluconate rate was exactly right, she said. I know, Mara said, and then caught herself. I recalculated it twice. I know what you mean. Adeyemi looked at her over the chart. Who taught you the QT correction formula at these electrolyte levels? A pharmacist, Mara said. Forward operating base, Afghanistan. He was very good at his job. Adeyemi studied her for 3 full seconds. Then she turned back to the chart without pressing further, but her pen moved more slowly across the order sheet than it had before, as if some piece of her attention was still allocated to what she'd just heard. The lab results came back at 22:15, magnesium level correcting, cardiac markers stable. Adeyemi adjusted the monitoring parameters, added a flag for any QT changes greater than 15 milliseconds in either direction, and signed the order sheet. He'll need continuous observation tonight, she said to the room generally. Not interval checks. Someone at this bedside. Yolanda Ferris looked at her nursing roster with the expression of a woman doing math that doesn't quite add up. I'm down 2 staff tonight. I'll take the watch, Mara said. Nobody argued, which was itself notable. Given that 12 hours earlier she had been a nurse nobody particularly noticed. The next 2 hours were quiet in the way that high-stakes quiet is. Not peaceful, but suspended. Mara sat with the Admiral, charted, watched the numbers, let her mind work through the variables she could do nothing about in this room while managing the ones she could. The younger officer, she finally learned his name was Lieutenant Solis, took a position outside the ICU door. Reyes moved between the floor and the administrative wing, where the IT team had set up in a conference room and was working through the access log data. At 11:40 p.m., Solis came through the door. His face was different, in the way that faces are different when they're carrying information that changes the weight of the room. We have a problem, he said. Another one, Mara said. It found a secondary data pull. Puel's access earlier tonight was the one they caught. But there was an earlier access, 6 days ago, from a terminal in the medical records department. That one pulled a different set of files. He paused. It pulled the staff roster, specifically nurses assigned to the ICU and trauma rotation. She felt something shift in her chest, not toward fear, away from it, the specific movement of someone stepping back from an edge to get a better view of it. They were vetting the staff before the Admiral arrived, she said. That's what it looks like. Which means whoever coordinated this knew he was coming to Hartwell specifically, before the helicopter incident. This wasn't reactive. It was pre-positioned. Solis nodded. And the staff roster pull 6 days ago. Was my name in that rotation? He met her eyes. Yes. She sat with that for a moment. Not because it frightened her, although something adjacent to fear was present, but because it reordered the timeline in a way that mattered. If someone had pulled the staff roster 6 days ago, they had potentially identified anyone on the ICU rotation with a background that might cause problems. Anyone who might recognize things that were meant to go unrecognized, who might notice what was designed to look like natural deterioration. It was a pre-operational threat assessment, and she was apparently on it, which meant her background was not as invisible as she had spent 4 years assuming it was. "Where's Reyes?" she said. "Conference room BIT briefing." She looked at the Admiral, at the monitors, at Nalini, who had stayed past her shift without being asked and was now running on coffee, and the particular stubborn energy of someone who has committed to a thing and will not leave it unfinished. "Dr. Nalini," she said, "can you sit with him for 5 minutes?" Nalini moved to the bedside without asking why. Mara went to conference room B. The room smelled like cold coffee and dry erase markers, and the specific tension of people who have been working a problem for hours without a clean resolution. Reyes was at the head of the table. 2 IT analysts. A woman in a gray suit who had not been in the building earlier and who Mara recognized from certain details of posture and the specific way she'd positioned herself relative to the exits. As Federal, Reyes looked up when Mara came in. "Solis told me about the roster pull," she said. "Sit down. I want to hear everything you have." She said it like that, not as a request. The way she might have said it 8 years ago in a briefing room at Fort Kellerman when she was a different person with a different set of visible credentials. The woman in the gray suit looked at her with sharpened attention, and Reyes, to his credit, simply pulled out the chair. She sat. The IT analyst, a young man named Brower, who had the manic, competent energy of someone who had found something significant and was managing the excitement of it, walked her through what they had. The first access, 6 days prior, pulling the staff roster and specifically flagging 3 names, 2 ICU nurses who had former military service, and Mara. The second access tonight, Poole, pulling the medication chart and treatment protocol. And a third data point that Brower had only confirmed in the last 20 minutes. An outbound transmission from a hospital network terminal at 22:37, 11 minutes after Poole had badged out, containing a compressed file that the firewall had flagged, but not blocked because it had been transmitted through a legitimate administrative reporting portal. "What was in the file?" Reyes asked. "We're decrypting now," Brower said. "But the file size and structure suggest it's a patient summary document. Could be the Admiral's full chart or a curated subset." "Someone transmitted his clinical information outside the hospital," the woman in gray said. "To no one specifically, just placing the fact in the room." "Someone transmitted his treatment protocol," Mara said. "Not just his chart, specifically the neurological suppression protocol and the medication schedule, the window-by-window care plan." She looked at Reyes. "They're not done." "Explain," the woman in gray said. "Puel's adjustment tonight was designed to be subtle. Magnesium concentration bump that would look like deterioration. When I caught it, that approach failed. But if someone outside this building now has the full treatment protocol, they know exactly what's being administered and when, and they can advise on a different method. Something that works within the existing clinical parameters instead of against them." Silence. "You're saying a second attempt is being planned," Reyes said. "I'm saying the information required to plan a better one was transmitted 40 minutes ago. Whether they act on it depends on how quickly they can adapt, how much access they still have inside this facility, and how much time they think they have before the panel testimony becomes moot." She paused. 72 hours, you said." 69 hours and change at this point, Reyes said. "Then we need to assume a compressed timeline." The woman in gray said, "What are you proposing?" Mara looked at the table, at the data printouts, the access log, the partial picture of a coordinated operation that had been running quietly through the infrastructure of a trusted institution for at minimum 6 days and possibly much longer. The Admiral can't be moved. He's not stable enough for transport without risk. But keeping him here means keeping him in an environment where at least one person has already demonstrated the ability to reach him, and where we don't yet know the full scope of who else might be accessible to outside influence. She looked at Reyes. You need to lock down his clinical care to the smallest possible team. People who can be fully vetted in the next 6 hours. No rotation changes, no new faces, no administrative access to his chart from any terminal except one physically secured and monitored. And clinically, Reyes said, Adeyemi and I manage him. Nobody else has hands on him without one of us present. The woman in gray made a note. That's an unusual arrangement for a hospital environment. So is someone trying to kill a patient by adjusting his IV? Mara said. The gray-suited woman looked at her for a moment with an expression that was not quite a smile but was adjacent to one. The expression of someone who has heard a thing stated plainly and found the plainness useful. Reyes said, I'll need to brief the hospital administrator. Brief whoever you need to, Mara said, but make sure you know who you're briefing before you do it, because the person who pulled the staff roster 6 days ago had access to administrative systems. And Puel is the one we identified, but Puel has been here 9 years and he's mid-level. Someone higher up gave him cover. The room was quiet. Then Reyes said, What makes you say that? Because the first access, the roster pull, required elevated permissions that Puel's administrative login doesn't have. She looked at Brower. Tell him. Brower glanced at his screen, then at Reyes. She's right. The access tier for that pull was level 4, Puel is level 2. Someone above him pulled the roster, Reyes said, and Puel executed tonight. Which means Puel is the action arm, Mara said, not the brain. And the brain is still in this building, or was until very recently, and has enough institutional authority to operate without raising flags. Reyes stood. He moved to the door and then stopped, his hand on the frame, and turned back. I need you on this officially, Osei. Not as a nurse managing the bedside, as the person you actually are. She had been expecting it. She had been sitting with it for the last hour, the slow settling of an inevitability she had postponed for 4 years through careful choices and deliberate invisibility, and the particular discipline of someone who had decided that a quiet life was worth the friction of maintaining it. She had built something in Carver Bay. Small, functional, imperfect. Kip on the kitchen counter, the second-hand novels, the tea, but hers. I'll need certain things in writing, she said. Name them. My separation status remains intact. No retroactive service obligations. My current employment at Hartwell is not disrupted. And whatever operational role I take in the next 69 hours is formally advisory. I'm not carrying a weapon. I'm not in a chain of command. And when this is over, I walk back out the same door I walked in. Reyes looked at her steadily. Agreed. All of it, in writing, from someone with the authority to make it binding. He looked at the woman in gray. She nodded once. I can have documentation in your hands in 40 minutes. Mara stood. Then I'm going back to my patient. Bring the paperwork to the ICU. She walked out of the conference room and down the corridor and through the stairwell and back to the 4th floor, and the whole way she kept her breathing level and her pace even and her face neutral, because the alternative was to acknowledge the feeling that was moving through her chest. Not fear, not quite, but something adjacent to the sensation of stepping off a high place into water, the compressed moment between decision and consequence. She came back through the ICU doors. Nalini was at the bedside. The monitors were stable. The Admiral was breathing steadily under the ventilator's support, his face still, his hands resting at his sides with the curl gone now. Relaxed, or as relaxed as someone could be in the particular suspended state he was occupying. Anything change? Mara asked. No, he's been... Actually, wait. Nalini was looking at the EEG strip that Adeyemi had ordered. This is new. Mara looked at the strip. There was activity in it that had not been there an hour ago. Not dramatic, not a seizure pattern, not anything alarming, but present and directional, and the specific quality of it made her lean closer. Is Adeyemi still here? She went to get coffee. I can get her. Nalini went. Mara looked at the strip again. At the particular signature of it, the pattern that was neither the deep uniformity of coma nor the fractured complexity of injury response, but something in between that she had seen before, once, in a recovery room at Bagram, when a soldier named Okonkwo had been unconscious for 11 days and had begun, on the 12th, to come back. She looked at the Admiral's face. His eyelids moved. Not the faint flicker of RM or pain response. A deliberate movement, small, labored, the enormous effort of a person trying to cross a very long distance very quickly. His right hand shifted against the sheet. "Admiral," she said quietly. His eyes opened. Not fully. Halfway, the lids heavy, the eyes themselves unfocused in the particular liquid way of someone emerging from deep sedation. He looked at the ceiling, then moved his gaze sideways by degrees, the way movement happens when the infrastructure for it is still being reestablished. His eyes found her face. She said, "You're at Hartwell Naval Medical Center. You're safe. Don't try to speak." His mouth moved anyway. The ventilator made it silent, but she could read the shape of it. She had spent enough time in enough rooms where the only communication was the shape of a mouth, and she looked at what he was trying to say and felt the floor of everything shift beneath her. Because what he was mouthing was not a name. It was not a request for water, or a location check, or the disoriented question of someone surfacing from sedation. It was two words, deliberate and clear, repeated twice to make sure she understood. Not pool. She leaned closer. His eyes were more focused now. He looked at her with the specific stripped-down intensity of a man who has approximately the amount of strength available to him that is required to say one thing and has chosen to spend it on this. "Holt," he mouthed. "It's Holt." And the door to the ICU opened behind her. She did not turn around immediately. The fraction of a second she used instead went toward making her face do the right thing. Not blank, not alarmed, not the specific expression of someone who has just received information that changes the geometry of the room they're standing in. She let her eyes stay on the Admiral's face, let her hand stay where it was on the bed rail, and breathed once through her nose. Then she turned. Marcus Holt stood in the ICU doorway. He was wearing his coat, which meant he had come from outside or was preparing to leave, at 11:58 p.m., which was not a time when the chief of trauma surgery typically appeared on the floor he had signed out of hours ago. He was carrying a tablet, which gave his presence a clinical plausibility, and he had the expression of a man returning to check on a case that concerned him, which was not an unreasonable expression for him to wear. He had worn it before, in this room, and it had read as conscientious then. It read differently now. "I heard he had some activity," Holt said. His voice was even. He moved toward the bed. "He's showing early emergence indicators," Mara said. She kept her body positioned between him and the Admiral. Not dramatically, not as an obvious barrier, but in the way a person positions themselves when they have somewhere specific to stand. "Dr. Adeyemi is coming back with an updated assessment." "Good." He stopped about 4 feet away and looked at the monitor. "QT back to normal range, that's fast." The calcium gluconate was well timed. He looked at the EEG strip. He was a surgeon, not a neurologist, but he was smart enough to read what the strip was showing. His eyes moved to the Admiral's face, to the eyes that were still half open, still tracking, still carrying in them the specific dimming quality of someone who had spent everything they had on one message and was now receding back toward the place they had come from. Holt looked at the Admiral's face for just a beat longer than he should have. It was a small thing, the kind of thing that would have meant nothing 2 minutes ago. "I'll do a quick physical check while I'm here," he said. He was already reaching for his stethoscope. "I'd prefer we wait for Dr. Adeyemi," Mara said. Holt looked at her. The look was mild, almost curious, the look of a man encountering an unexpected obstacle in familiar terrain. "I'm still the attending of record on his trauma case, Osei." "You are," she said. "And I'm the nurse with continuous bedside observation, and my documented assessment of his current neurological emergence recommends minimal stimulation pending specialist review. I'd like to hold to that." A beat. "Not long. 3 seconds? Maybe 4. "Of course," he said, smoothly. "The way water runs around something solid. I'll wait for Femi." He moved to the charting terminal at the side of the room. A reasonable thing to do. a perfectly reasonable thing for an attending physician to do while waiting in a patient's room. He pulled up the chart, and she watched his hands on the keyboard in her peripheral vision while she kept her body angled toward the Admiral and her face pointed at the monitors. He was looking at something specific. She could tell from the pace of his scrolling, deliberate, not browsing. He had come here to look at something particular, and he was looking at it now, and the tablet under his arm was not incidental. Nalini came back through the door, followed by Adeyemi. Adeyemi looked at the EEG strip first, as she always did, before looking at anything else. Then she looked at the Admiral's face. Then she looked at Holt. "Marcus," she said. Not warmly, not coldly. "Femi, he's emerging." "I can see that." She moved to the bedside, and the movement was sufficient to require Holt to step back from the terminal, which he did without being asked. "Give me some room." Mara stepped aside but stayed close. She positioned herself between Adeyemi's assessment and the charting terminal without making it look like a strategic choice, which it was. Adeyemi ran her assessment for 90 seconds. Pupils, response, the specific battery of checks that would tell her what kind of emergence this was and at what stage. She made notes on her own clipboard, not the tablet, not the system. When she was done, she said to Mara quietly, "We need to reduce the sedation protocol. He's fighting it now, which creates its own risks." "Agreed," Mara said. "I'll write the orders," Holt said from his new position nearer the door. "What's your timeline for full consciousness?" "Unknown," Adeyemi said. "Could be hours, could be tomorrow. Depends on how his nervous system has responded to the correction." She turned to look at him directly. "Why are you here at midnight, Marcus?" It was the question Mara had wanted to ask and hadn't, because she needed Holt in this room for another 4 minutes. She had texted Reyes from her pocket, without looking at her phone, the moment Holt had moved to the terminal. The text said 2 words, "I see you now." She didn't know if it had gone through correctly. She didn't know where Reyes was in the building. She needed 4 more minutes of normalcy. "I got a notification on my remote chart access," Holt said. "Vital sign change. Old habits." "Which change specifically?" Mara said. He looked at her again with that mild, recalibrating look. "The blood pressure movement." "That happened 90 minutes ago," she said. "You're here 90 minutes later." The room temperature didn't change physically, but something in it shifted. Nalini had gone very still near the EEG machine. Adeyemi had stopped writing. Holt said, "It took me a while to see the notification." "Of course," Mara said. The ICU door opened. Reyes came through it with Solis behind him, and behind Solis was a man Mara had not seen before. Older, heavy-set, in a dark jacket, with the particular bearing of federal law enforcement that was different from military in ways she couldn't have articulated precisely but recognized without effort. He moved with the economy of someone who had done this before, the arrival into a room at the specific moment of confrontation, and he positioned himself without instruction at the angle that covered the only exit. Holt saw him, and in the 2 seconds between seeing and responding, Mara saw it. The calculation, the rapid internal accounting of a man determining whether the position he is in is recoverable. She had seen that calculation before, on other faces, and she knew what it looked like when the numbers came up wrong. It looked like what was happening on Holt's face right now. "Marcus," Reyes said. His voice was completely controlled. "I need you to step away from the chart terminal." "I'm reviewing my patient's file," Holt said. "Step away from it, please." Holt set his tablet down on the edge of the terminal, carefully, precisely, the gesture of a man managing his composure by managing his hands. He stepped back. His face was doing the same thing Mara's had done 3 minutes ago, running the calculation behind the expression, trying to find the version of this that was survivable. "I'd like to know what this is about," he said. "I think you do know," Reyes said. The man in the dark jacket moved to the terminal and put on gloves, latex from his jacket pocket, and began working with the careful documentation of a person who understood that what they were doing would eventually be seen by people in rooms where the handling of evidence was the only thing that mattered. He photographed the screen. He pulled a small device from his other pocket and connected it to the terminal's USB port. Holt watched this and said nothing. "The staff roster accessed 6 days ago," Reyes said, coming closer. Not aggressively, conversationally, the specific distance of someone delivering a prepared set of facts. "Level 4 administrative credentials. Your hospital access is level 4. A lot of senior medical staff have level 4. Yes. But the terminal used for that access was in the physician's administrative suite on 7, which uses badge entry. The badge log shows you accessed that suite at 14:20 on the day in question. I'm in that suite regularly. You were in it for 41 minutes, Reyes said, and you badged out 11 minutes after the roster pull was completed. Holt's jaw moved. A small adjustment, like something that had been held in a particular position being carefully set down. The tablet under your arm, Mara said. She said it quietly, without emphasis, the way you say a thing when you don't need volume to make it land. You came in holding it. You haven't looked at it since you got here. You came to look at the chart terminal specifically, to see what we know, or to change something, or both. Holt looked at her. The mildness was gone. What was underneath it was not what she expected. Not rage, not cold calculation, but something exhausted. The specific exhaustion of a person who has been managing a terrible thing for a long time and has reached the boundary of how much longer they can manage it. You have no idea what you've been sitting in the middle of, he said. Tell me, she said. Osei. Reyes's voice carried a note of caution. Tell me, she said again, ignoring it. Because I've been in this room for 6 hours keeping him alive, and I'd like to understand what for. Holt looked at the Admiral. At the man in the bed, half-conscious, breathing with mechanical assistance, the product of a night that had tried and failed to end him. He was going to testify about procurement decisions that go back 8 years, Holt said, before the panel. Decisions that implicated people I thought were operating in the country's best interest. I thought... He stopped, restarted. I was told the testimony would cause damage to ongoing operations, real operational damage. People in the field. So you were recruited, Reyes said, approached, by someone I had reason to trust. And you pulled the roster to identify clinical staff who might recognize what you were doing. To identify staff who had backgrounds that would... Holt stopped again. He looked at Mara with something that was almost, in a different context, an acknowledgement. I flagged 2 names. Neither of them was yours. Your file didn't show anything that... He paused. I didn't flag you. And yet here we are, she said. He looked at the floor briefly. Here we are. The man in the dark jacket had completed his work at the terminal and was now looking at what he'd pulled from it, not reacting visibly, just reading, with the careful expression of someone building a record. Dr. Holt, Reyes said, I'm going to ask you to come with me. Am I being detained? You're being asked, Reyes said. At the moment, whether it becomes a detention depends on what happens in the next 20 minutes. Holt picked up his tablet with both hands, looked at it without seeing it, and set it on the charting table. He looked at the Admiral one more time, a long look, not clinical, something else. The look of a man trying to do something with a decision he has had to live with and can no longer hold on to. I wasn't trying to kill him, Holt said. The magnesium adjustment was supposed to slow his recovery, extend the timeline past the testimony window. Not, that's for other people to determine, Reyes said. I know, Holt said. He walked to the door. He did not look at Mara again, and she did not call after him, and the door closed behind him and Reyes and the man in the dark jacket, and the ICU was left with the sound of the monitors and the ventilator and Adeyemi's pen moving across her clipboard. Nalini said from across the room, in a voice that was trying very hard to be steady, Did that just happen? Yes, Mara said. The chief of trauma. Yes. Nalini sat down on the rolling stool near the EEG machine and put her hands on her thighs and looked at the floor. Mara understood the particular quality of what was happening in the resident. The reorganization of a professional landscape that had looked one way for years and now looked entirely different. The unsettling mathematics of realizing that authority and competence are not the same thing, and that the former can exist in complete absence of the latter. Are you okay? Mara asked. No, Nalini said. But I'm fine. I mean, I know what you mean. Adeyemi had not stopped working. She looked up from her clipboard long enough to say, The sedation reduction orders are written. Someone needs to countersign. I'll get the on-call physician, Nalini said, pulling herself back together with visible effort, standing, moving, which was the right response to the situation, even if it didn't feel like enough. The next 3 hours were procedural, in the specific way that procedure serves as structure when everything outside of it has become chaotic. the sedation reduction, the monitoring adjustments. The paperwork that Solis brought to the ICU at 1:15 a.m. 2 copies. Mara's formal advisory designation and the terms she had specified, signed by the woman in the gray suit whose name, she finally learned, was Deputy Director Anise Wolfe of the Naval Criminal Investigative Service. The signature was real, and the terms were what she had asked for, and she signed her copy with the specific unromantic feeling of someone who has agreed to something necessary rather than something wanted. Reyes came back at 1:40. "Holt is cooperating," he said. He said it without evident satisfaction, which she respected. "He's given us the name of the contact who approached him, civilian contractor with ties to 2 of the companies implicated in the Admiral's testimony. We're tracking the contractor now." "Puel?" "In custody. He ran to a marina on the south end of Carver Bay. Not his best decision." A pause. "He also gave up the contractor's name independently, which confirms Holt's account." "Are they the end of the chain?" "Probably not," Reyes said, "but they're enough to secure the testimony window. We move the Admiral's testimony to a secure location when he's stable enough, which buys us distance from this facility and anyone else who might have been accessed by the people above them." Mara looked at the Admiral's face. The emergence had stalled, the nervous system retreating again after its brief, exhausting effort. The man slipping back into the deep sedation that the magnesium had already been undermining before the reduction protocol started. He was not unconscious in the same way he had been hours ago. The EEG showed activity, persistent and directional. He was in there, working in the particular slow and enormous way of a body knitting itself back together from the inside. "He knew," she said. "What?" "The Admiral. He knew about Holt." She looked at Reyes. "He came out of sedation for maybe 90 seconds, and the thing he chose to spend it on was mouthing Holt's name at me, which means he'd known or suspected before the helicopter, and he held on to it through everything that happened tonight." Reyes was quiet for a moment. "He's a careful man." "He's a stubborn one," she said. "There's a difference." The faintest movement at the corner of Reyes's mouth. Not quite a smile. The acknowledgement of a distinction that he found accurate. "The testimony panel has been notified. Security protocols around his transfer will be at a level that should have been in place before he arrived here." He paused. "That's on us." "It's on several people," she said. "Yes." He looked at her. "What you did tonight, what you've done since he arrived. There are people who need to know about it formally. The record of what happened in this facility needs to be accurate, including who prevented what." "Write it accurately and I have no objection," she said. "I'd rather not be in the room when it's written." "Noted." He moved toward the door, then stopped. "The paperwork Wolf signed, the terms you asked for. She told me afterward that she'd agreed to them before she finished reading them. Because they were reasonable. Because they were exactly what she'd have written if she'd been drafting them herself," he said, which told her something about the person asking for them. He left. Adeyemi stayed until 4 a.m., when the Admiral's numbers had been stable long enough to satisfy her own internal threshold. Not a clinical standard exactly, but the particular standard of a specialist who has seen enough recoveries to know what holding looks like versus what managed decline looks like, and who trusts her own read of the difference. She handed off to the day neurology team with instructions that were 4 pages long and written in her precise, dense hand. Before she left, she stood beside Mara at the nursing station. "Fort Kellerman," she said. Mara looked at her. "I heard Reyes say it earlier. I wasn't meant to, probably." Adeyemi studied the wall above the station, not Mara's face. "I served 2 years as a flight physician with the Army. Different theater, different timeline. But I know what that name means." Mara didn't answer. "I'm not asking you to explain yourself," Adeyemi said. "I've been a black woman in academic medicine for 25 years. I know what it costs to make yourself small enough to survive in a room that wasn't built for you. I'm not going to ask you to account for how you managed it." She looked at Mara then. "I'm just saying the pharmacist at the forward operating base who taught you the QT correction formula. Was he good?" "The best I ever worked with," Mara said. "Good teachers leave marks." Adeyemi picked up her bag. "Get some sleep when this is over." She walked out. The ICU settled into the quiet of very early morning. The monitors continued. The ventilator continued. Mara sat in the chair beside the Admiral's bed and documented, and cross-checked, and documented again. And somewhere around 5 a.m., she allowed herself to lean back in the chair and close her eyes for 3 minutes, not sleeping, just existing in the dark behind her eyelids, where there was nothing to assess and nothing to manage and nothing to protect. The day shift came in at 7. Dennis Quill appeared at 7:15, which was not his shift, which meant he had come in specifically. He stood in the ICU doorway and looked at Mara and at the Admiral and at the monitoring station, and his face ran through several things in quick succession before settling on the expression of a man who has been working in hospitals long enough to know that the way a room feels after a night like this is different from the way it feels after a normal night, and who can read that difference without needing it explained. "Holt's been suspended pending investigation," he said. "I know." Hospital administrator was briefed at 6. "She's not doing well, emotionally. He's been here since before she arrived." He paused. 3 department heads have already sent emails asking what happened. "What does the hospital plan to say?" "As little as possible for now. NCIS involvement puts most of it under federal jurisdiction." He looked at the Admiral. "You gonna make it?" "Yes," she said. "You sure?" "I've been watching him for 8 hours. Yes." Quill nodded. I was quiet for a moment, and in the quiet, she could see him working up to something. Not the reluctance of a man who doesn't want to say a thing, but the specific care of a man choosing how to say it right. "The incident report Holt filed last night," he said. "Unauthorized interference in active emergency response. I was asked by the administrator to review it this morning, given the circumstances." She waited. "I found 4 significant documentation errors in it," he said. "Timestamps inconsistent with the monitoring record. A characterization of your intervention that doesn't match the chart entries or the witness accounts I've collected." He looked at her steadily. "I've submitted a formal correction and requested that the original be stricken from your personnel file." She held his gaze. "Thank you, Dennis." "I should have pushed back harder last night when he filed it," he said. "I knew the timeline was wrong and I let it go because I didn't—" He stopped. "I'm not going to make a speech about it." "Good," she said. "I don't need a speech." He almost smiled. "Get some sleep, Osei." He left. She stayed until 8 because the day team needed a proper handoff, and because she was not, by nature, a person who handed off things incompletely. She walked the day nurse through every decision point in the chart, every monitoring flag, every instruction Adeyemi had left, and why. The day nurse, a competent woman named Brecht, who had been at Hartwell for 6 years, listened carefully and asked 3 specific questions, all of them good ones. At 8:17, Mara collected her notebook and her bag and walked out of the ICU. In the corridor, she passed the room where the Admiral's 2 Navy escort officers had been stationed, empty now, the chairs pushed back from where they had sat in them for hours. She passed the family consultation room, also empty. She passed the door to the stairwell. She stopped. Reyes was standing in the corridor 20 feet ahead near the elevator, in conversation with Deputy Director Wolf. They were looking at something on Wolf's phone. Both of them still, both of them with the particular quality of attention that meant the thing on the phone was significant. Reyes looked up when she stopped. He held up one finger. A moment. She waited. He said something to Wolf, and Wolf looked at Mara, and then Wolf held out the phone. "You need to see this," Reyes said. She walked to them and looked at the screen. It was a photograph. Time-stamped 40 minutes ago from a traffic camera on Route 17 south of Carver Bay. Image enhanced by whatever system NCIS ran for this kind of retrieval. It showed a vehicle. The same vehicle Puel had been in when security cameras caught him leaving the hospital parking structure the night before. Which was impossible, because Puel was in custody. "That's not Puel's car," she said. "It was Puel's car," Wolf said. "He reported it stolen this morning from the impound facility where it was being held." Mara looked at the photograph again. Gone at the vehicle, at the timestamp, at the direction it was traveling, south, away from the city, toward the stretch of coast that she had driven past twice since moving to Carver Bay without thinking anything specific about it, the area where the naval installation's secondary access road ran parallel to the highway before splitting off toward a series of facilities that were technically civilian-adjacent, medically designated, occasionally used for overflow patient transfers, where, she had learned last night from the NCIS briefing documents, the Admiral was scheduled to be moved in approximately 4 hours. Wolf said, "The transfer location may be compromised." "It's not maybe," Mara said. Someone above Holt and Poole in this chain knew about the transfer plan and has a vehicle moving toward the transfer point right now. Which means the chain goes higher than the contractor, Reyes said. Which means it was never just about the testimony, Mara said. It was about making sure he never gives it. Wolf's phone was already at her ear. Reyes was looking at Mara with the expression of a man recalibrating, again, the scope of what he was inside. And in the ICU behind them, connected to a ventilator and a monitoring system and the particular quiet watchfulness of a day nurse, who had just been handed a very careful chart, Admiral Raymond Voss breathed steadily in and out, unaware that the operation designed to end his life had not, in fact, ended with the arrest of the two men who had been its visible face. Wolf made 3 calls in 4 minutes. Mara stood in the corridor and listened to the shape of them, not the content, because Wolf had moved 6 feet away and was using the clipped, minimal language of someone who has learned to transmit maximum information in minimum words to people trained to receive it that way. What she could read from the cadence was urgency calibrated to action, not panic. The difference mattered. Panic generated noise. This generated movement. Reyes was on his own phone. Solis had appeared from somewhere. The stairwell, probably. He seemed to materialize from stairwells, and was receiving a rapid verbal brief that Reyes delivered without looking up from his screen. Mara looked at the photograph on Wolf's phone, which Wolf had left in her hand before stepping away to make the calls. The vehicle was a gray utility van, nondescript in the specific way that nondescript becomes its own distinguishing feature when you're looking for it. Virginia plates, partially obscured but recoverable from the image. Moving south on Route 17 at the timestamp, which put it, she ran the distance in her head against approximate highway time, somewhere between 12 and 18 minutes from the secondary access road depending on traffic, and whether the driver knew the route well enough to take the shorter split. She looked at the timestamp again. The photograph had been taken 40 minutes ago. Wolf had said 40 minutes, which meant the window was not 12 to 18 minutes. The window was already closed or closing, and whoever was in that van had either reached the transfer point or was approaching it, and the transfer convoy, the Admiral's secure movement to the alternative location, was scheduled for approximately 4 hours from now, which meant the van wasn't time for the transfer itself. It was time for something else. She handed the phone back to Wolf, who had finished her calls and returned with the compressed, decisive manner of someone who has set things in motion and is now managing the interval before they resolve. The transfer is postponed, Wolf said. The convoy has been stood down. That solves the transfer problem, Mara said. It doesn't solve what the van is going to do when it gets there and finds nothing. We have people moving to intercept. How many? Enough. That van left 40 minutes ago. Your people are moving now. The math on that. I know the math, Wolf said. It wasn't sharp. It was the tone of a woman who has done this long enough to have learned that naming a problem and solving a problem are not the same operation, and who doesn't need the problem named twice. Our intercept team has faster routes than Route 17. We'll have eyes on the secondary access road in 8 minutes. Mara let it go. She was not in the operational chain here. The paperwork she had signed was explicit about that, and inserting herself into decisions that belonged to other people's expertise was not something she did. She had learned that distinction the hard way, in a different context, and the lesson had held. What she could do was go back to her patient. She turned toward the ICU. Osei, Reyes said. She stopped. Stay accessible, he said. We may need your read on something. I'll be in the ICU. She went back through the doors and took the same chair she had vacated 20 minutes earlier and looked at the Admiral's face and at the monitors and at the EEG strip that continued its activity in the quiet, persistent way of a brain that has decided it is not done yet. Brecht, the day nurse, looked at her from across the room. You're off shift, she said, not critically, observationally. I know, Mara said. I'm not here clinically. She stopped because the sentence didn't have a clean ending. She was here because she had spent the last 10 hours in this room, and the idea of walking out to her car and driving to her apartment and feeding Kip and making tea, while something she didn't know the resolution of was still unfolding, felt functionally impossible in a way she couldn't justify with logic. I know, Brecht said, in the tone of a woman who had been a nurse long enough to understand that some situations create a kind of attachment that doesn't respect the end of a shift. She pulled a chair from the corner and set it beside Mara's without further comment. They sat together in the particular companionable silence of two people with a shared purpose who don't need to discuss it. At 9:43 a.m., Mara's phone buzzed. Reyes. Van intercepted. 2 occupants. Federal custody. Devices recovered. We're clear. She read it twice. Then she set the phone face down on her knee and looked at the window above the Admiral's bed. The narrow rectangle of it, the Virginia coastlight coming through it, pale and salt gray in the way of late autumn mornings when the weather can't decide whether it's done raining. 2 hours later, the Admiral opened his eyes. Not the half-conscious emergence of the night before, not the enormous, exhausting effort of a man spending the last of his reserves on a message he needed to deliver. This was different, slower and more complete. The eyes opened, focused, adjusted to the light, with the deliberate quality of a person who is fully present and knows where they are and is taking a moment to confirm it before doing anything else. He looked at the ceiling, he looked at the monitor, he looked at the IV line in his arm. He looked at Mara. Brecht had paged Adeyemi the moment his eyes opened. The ventilator was in the process of being weaned. They'd started the process at 9, ahead of schedule, because his respiratory effort had been increasingly fighting the machine rather than accepting it, which was, Adeyemi had said, a frustrating but encouraging sign. He was on minimal support now, enough to assist without driving, and when he opened his mouth, the first sound that came out was rough and uncertain, but it was his. Water, he said. Brecht got it. Ice chips first, standard, and he accepted them without argument, which told Mara he'd been through enough medical situations to know the protocol without needing it explained. Adeyemi arrived in 7 minutes. She ran her assessment with the same deliberate efficiency she brought to everything, and the Admiral tolerated it with the patience of a man who understood that the people in this room had not slept and had earned the right to take their time. When she was done, she said, "Your nervous system staged a remarkable recovery," in the specific tone she used for facts that she found professionally interesting. "I had help," he said. His voice was still rough, still finding its range. "You did," Adeyemi said. She looked at Mara briefly. "More than you know." The Admiral looked at Mara too. It was a different look from the one he'd given her at 2 in the morning. That one had been functional, stripped down to its essential purpose. The look of a man with one thing left to accomplish. This one had more in it. The particular quality of attention that a person gives someone who has become real to them in a specific way. "You were here," he said. "Most of the night," she said. "You caught the thing they did to the line." "Yes." I was quiet for a moment, processing or resting, hard to tell which. "And Holt? He's in federal custody, cooperating." The Admiral closed his eyes briefly. Not grief exactly. Something more complicated, the specific weight of learning that a betrayal you had suspected but not confirmed is now confirmed, and there is nothing in the confirmation that feels like satisfaction. "I thought it might be him," he said. 3 weeks ago, I noticed a discrepancy in access logs for my pre-hospitalization medical file. Someone had pulled it. The access traced back to a physician credential at Hartwell." He paused. "I didn't have enough to act on it then." "You acted on it last night," Mara said. "I spent it on his name." The ghost of something moved across his face. "I wanted to make sure someone knew, in case I didn't come back around." "You came back around," Brecht said, from across the room, with the mild firmness of a nurse who has decided the emotional portion of this conversation has been sufficient, and it is time to monitor a blood pressure. The Admiral, to his credit, almost smiled. Reyes arrived at the ICU at 11 a.m. with Wolf and Solis and the specific composed energy of people who have been running hard since midnight and have reached a point where the immediate emergencies have resolved, and the longer, slower work of consequence is beginning. He briefed the Admiral for 20 minutes, concise, factual, the 2 occupants in custody, and the Holt and Puel situations, and the contractor whose name had been confirmed by 3 independent sources and who was now the subject of a federal warrant. The Admiral listened without interrupting. He asked 2 questions, both of them precise, and received precise answers. When Reyes was done, the Admiral said, "The testimony panel. Rescheduled for 72 hours from now. Secure location. Full protective detail," Reyes said. "You'll be well enough to travel by then, based on Dr. Adeyemi's preliminary assessment." "I'll be well enough to travel in 48 hours, the Admiral said. "The doctor's assessment, I'm aware of what the doctor's assessment says. He looked at Adeyemi. With appropriate medical support during transport. Adeyemi considered this in her unhurried way. 48 hours in a medical escort? Yes. 48 hours in a car? No. Agreed, he said. Then he looked at Mara. I'd like to speak with Nurse Osei, he said. Privately. Wolf and Reyes and Solis moved toward the door. Adeyemi stayed long enough to make a final notation, then followed. Brecht made the professional judgment that taking a brief break at this specific moment was appropriate and slipped out with the quiet competence of a woman who has spent 6 years learning when to be in a room and when not to be. The ICU held only the two of them and the sounds the machines made. The Admiral looked at Mara with the particular directness of someone who has been in command long enough to dispense with the conversational structures that other people use to approach difficult things. Reyes told me about Fort Kellerman, he said. Did he? Operation Sandline. 11 soldiers extracted from a position that should have been unsurvivable. The combat medic who made that possible was cited for a commendation that was subsequently lost in a reclassification process that nobody seems to be able to fully explain. He paused. I can explain it. She felt something shift in her chest. Not surprise. She had spent 4 years with the shape of this thing, the outline of it, the knowledge that the reclassification hadn't been administrative error. But hearing it acknowledged directly was different from knowing it alone. The operation touched assets whose existence was politically sensitive at the time, he said. Acknowledging the commendation meant acknowledging the operation, and acknowledging the operation meant, I know what it meant, she said. Yes, you would. He looked at her steadily. It was wrong. The decision to reclassify was made at a level above mine, but I was informed of it, and I did not object to it, and that's something I've carried. He paused. I can't undo 8 years, but I can ensure that the record is corrected, formally and permanently, and that the commendation is reinstated with full documentation. I intend to do that, with or without your permission, because the record belongs to the institution, not to you. But I'm asking for your permission anyway, because it's your life. She looked at the monitor. At the steady green line of his heartbeat, the simple mechanical evidence of a man who was alive because a sequence of events that had begun with her noticing the position of his hands had proceeded in the direction it had. Why does my permission matter to you, she said. Because you've spent 4 years making yourself small to protect a privacy that you shouldn't have had to manufacture, he said. And the least I can do before I put your name back on a piece of paper is ask you what you want it to mean. She had not expected the question framed that way. She sat with it for a moment, not performing consideration, but actually sitting with it, the way she sat with clinical decisions that had weight, letting the components of it settle into their relative positions, what she wanted it to mean. She had left the Army with a specific and deliberate intention, to be a nurse, competently and without drama, in a place where the scale of what she was doing was legible and the results were visible and the people she helped were in front of her and not abstracted into operational objectives. She had wanted smallness, not because she was ashamed of what she'd done, but because the size of what she'd done had cost her things she hadn't been prepared to lose. A version of herself that trusted institutions, a certainty that the people above her in any structure were operating in the same direction she was, a belief that recognition would go to the people who earned it, rather than the people who were convenient to recognize. She had built something small and stable in Carver Bay. Kip on the counter, the secondhand novels, the tea, 4 months of night shifts, of restocking IV supplies, of sitting with a 22-year-old seaman who needed 11 minutes of attention before he could sleep. None of that had to change. Put the record straight, she said. File it and close it. I don't need a ceremony and I don't need a press release. The record existing is enough. That's all? All? That's all, she said. He looked at her for a moment with the expression of a man who is also not entirely comfortable with recognition, who has received enough of it to know what it costs to maintain and what it costs to refuse, and who can therefore appreciate the specific calibration of what she was asking for. Agreed, he said. She stood. She picked up her bag and her notebook. Nurse Osei, he said. She stopped. What you did last night, the full picture of it, not just the medicine. I want you to know that I understand it. What it cost you to step back into that territory, what you put at risk by doing it. She thought about that for a moment. about the studio apartment and Kip and the quiet she had built, about the moment in the trauma bay when she had looked at his hands and known, and the choice she had made, not to stay silent, not this time, not again. "I didn't do it for the record," she said. "I did it because I was in the room." She walked out. The corridor outside the ICU was quiet in the middle of the morning way. The frantic overnight energy fully dissipated, the day shift settled into its rhythm. The building returned to the functional business of being a hospital rather than the site of something else. She passed the nursing station where a day nurse she didn't know was reviewing a chart. She passed the family consultation room. She passed the elevator and took the stairs instead, because she always took the stairs. On the third-floor landing, she stopped and sat on the steps for a moment. She was tired in a way that sleep would address, but not entirely fix. The specific depletion that comes from operating at full capacity for extended periods in conditions that require you to be something more and something other than what you are on an ordinary Tuesday. She had a pull behind her eyes and a stiffness in her shoulders and a dull ache in her lower back from the chair beside the Admiral's bed, and all of these things were fine. They were the texture of a night that had happened and been survived, and she sat with them for a moment without trying to manage them. She thought about Holt, not with hatred. She didn't have the energy for hatred, and she was not, by nature, a person who stored it. What she felt when she thought about him was something more like the complicated disappointment of understanding how a person gets from one place to another. He had been a good surgeon. She had seen it in the efficiency of his repair, in the confidence of his clinical decisions, in the way his team moved around him. He had been good at the specific thing he did, and he had been approached by someone who understood that good people are often easier to compromise than bad ones, because good people have constructed elaborate justifications for themselves. And when you find the right leverage point, you don't have to recruit them into something they understand is wrong. You only have to give them a story in which what they're doing is right. He had believed a story. The story was a lie. The consequences of his believing it were going to follow him for the rest of his life. And whatever he had been, competent, respected, capable, was now permanently inseparable from what he had chosen to do. She was not glad about it. She was not sorry about it either. She felt about it the way she felt about most difficult and irreversible things, that they were true, and that their being true was what it was, and that the only productive question was what you did with the space that truth created. She stood up and walked the rest of the stairs. The parking structure was cold in the specific underground cold of a structure near water, the concrete holding the salt damp in a way that didn't let go until actual summer arrived. She found her car. She sat in it for less than a minute this time, shorter than the morning before, because there was less she needed to hold still and process. Some of the things she had been sitting with for 4 years had moved, and the movement had created room. She drove home. Kip was, in fact, on the kitchen counter. She fed him and made tea and stood at the window and looked at the water, which was flat and pewter-colored and quiet, in the particular way of the Virginia coast when nothing is moving across it. She slept 9 hours. She dreamed about nothing she could remember. She woke at 8 in the evening to 4 messages. Scheduling confirming her next shift, Adeyemi noting that the Admiral's extubation had proceeded without complications, Reyes with a brief operational update that ended with the 2 words "contractor detained," and Dennis Quill, who wrote, "Day shift says he asked for the nurse who was there overnight, just so you know." She put the phone down and made another cup of tea. The following days moved with the specific quality of aftermath, not resolution exactly, because resolution implied completion, and what she was living through was more like the gradual reestablishment of a landscape after something has moved through it and changed the topography in ways that won't be fully apparent until the light falls on it differently. She went back to her shifts. She restocked IV supplies when asked. She sat with patients who were scared and answered their questions and adjusted their medications and documented everything with the small, dense handwriting that was not about appearance. The staff treated her differently. Not dramatically. Nobody made speeches. Nobody flagged it openly. It was subtler than that. The space people gave her when she came to a bedside. The way questions got directed toward her rather than past her. The specific quality of being looked at that changes when what people see has changed, even if you are standing in the same place wearing the same scrubs, holding the same battered notebook. She noticed it and did not perform any particular response to it, because the recognition of other people was not what she had been working toward. She had been working toward the thing she was already doing, and the recognition was simply other people catching up to a fact that had been true before they acknowledged it. On the fourth day after the night that had changed the shape of her life in Carver Bay, she was restocking the IV supplies on the third floor, the same task she had been doing the night the helicopter came in, when Nalini appeared beside her. The resident looked different from the night in the ICU. Still tired, residency was a permanent condition of tired, but differently tired, the kind that has incorporated something and is carrying it differently. "I've been thinking about what to say to you," Nalini said. "You don't have to say anything." "I know. I want to." She leaned against the supply room wall. When you spoke up in the trauma bay and I shut you down, I thought I was being appropriately authoritative. I'd been told my whole training that in emergency situations you establish hierarchy clearly or people get hurt." "That's true," Mara said. "It's not the whole truth, though." "No," Mara agreed. "It's not." Nalini was quiet for a moment. "I'm trying to figure out how to hold both things. The need for clear hierarchy in emergencies and the fact that hierarchy can be wrong, and being certain that you're in the right position doesn't mean you're seeing everything that matters." "That's a hard thing to hold," Mara said. "Yes." A pause. "Did you always know how to do it? But see things that other people missed?" Mara considered the question honestly. "No, I missed things too. I missed things in ways that had consequences. That's actually what taught me to look harder." Nalini absorbed that. "Fort Kellerman," she said, not asking. "Some of it, not all." "I looked it up. I couldn't find much." "That's intentional," Mara said. "Right." Nalini straightened. "For what it's worth. And I know it doesn't balance what I did that night. You've changed how I'm going to practice. Not the hierarchy part. The seeing part." Mara looked at her. At the young resident who had walked into an ICU emergency with the certainty of her training and had been slowly, over the course of a terrible night, confronted with the limits of what certainty can do on its own. "That's worth a lot," Mara said. "Actually." Nalini nodded once and left, which was the right thing to do. On the sixth day, Deputy Director Wolf came to the hospital. Not operationally. The active case had moved far beyond Hartwell's walls by then, expanding into the contractor network and the acquisition irregularities that the Admiral's testimony was beginning, piece by piece, to illuminate before the oversight panel. What Wolf brought was paperwork. A formal correction to Mara's service record. The reinstated commendation from Operation Sandline, filed with the appropriate administrative bodies, and closing the 8-year gap with language that was dry and institutional and exact, and therefore, in its way, more powerful than anything ornate could have been. She also brought a letter, on Naval Command letterhead, signed by the Admiral. Mara read it standing in the corridor outside the staff lounge because Wolf had handed it to her there, and she hadn't thought to move somewhere else first. It was not long. 3 paragraphs. The language was precise and unflowery in the way of a man who had learned to write carefully in environments where careless words had consequences. The first paragraph addressed the record. The second addressed what had happened at Hartwell, and what it had cost, and what it had prevented. The third paragraph said only, "There is a particular kind of courage that does not announce itself. It waits and watches and does the necessary thing without requiring the room to validate it first. I have encountered very few people in my career who possess it without compromise. I wanted you to know that I understand what kind of person you are, regardless of what any document does or does not say about it." She folded the letter and put it in her notebook, between 2 pages of clinical documentation. "He wants to meet with you before he's transferred," Wolf said, "when he's well enough to be in a wheelchair without it being medically inadvisable." "I know," Mara said. "I'll be here." Wolf studied her for a moment with the same evaluative attention she had turned on her in the conference room 5 nights ago. "Reyes thinks you should consider coming back in, not full-time, advisory. The skill set you demonstrated has applications that don't require you to be in the Army to be useful." "Reyes can think what he likes," Mara said. "What do you think?" The corner of Wolf's mouth moved. "I think you already made your decision about what kind of life you want. I think you made it 4 years ago, and you paid for it, and it's yours." A pause. "I also think you're the kind of person who, when the moment requires it, does what the moment requires, regardless of what you want. Which means the quiet life isn't really quiet. It's just quieter." Mara looked at her. "The offer is open," Wolf said. No pressure, no timeline. You know where to find us." She left. Mara stood in the corridor for a moment. Then she went back to work. The Admiral met with her 10 days after the helicopter. He was in a wheelchair, as projected, in the family consultation room on the 4th floor, with Solis standing near the door and Reyes sitting against the wall with the specific posture of a man who is present but deliberately not participating. He looked better. Not well. The specific not well of someone who has been through a significant physiological event and is on the correct side of it, but still carrying its marks. He held himself carefully in the chair. His color was returning in stages. His eyes were fully clear. "I'm told you read my letter in the hallway," he said. "I did." "Not the most private venue." "It was fine," she said. He looked at her for a moment. "How are you?" It was an unexpectedly simple question, and she took it seriously. "I'm okay," she said. "Better than I expected to be, given everything." The hospital has opened a formal review of protocols for administrative system security and clinical information access, he said. They've also named a patient safety incident from the night I arrived that has been submitted to the state medical board regarding failure of the duty of care during initial presentation. She had heard this through Quill. "I know. Your name is in the review documentation as a staff member who identified the initial clinical concern and attempted to escalate it through appropriate channels." "I'm aware." "You don't seem particularly interested in any of this," he said. "I'm interested in the outcome," she said. "The documentation is for other people. The outcome is what matters to me." He looked at her with the expression she had first seen in the ICU, the recognition, the assessment, the particular quality of attention of a man who has met many people and can distinguish between the ones who want to be seen and the ones who want to do the thing. "What's the outcome, son?" he said. "You're alive," she said. "But the people who tried to change that are in custody or on their way there. The testimony panel has what it needs. And tomorrow I'm going back on the night rotation, and Dennis Quill is going to make me restock the IV supplies because I'm still the newest person on the shift, and that's appropriate." He was quiet for a moment. "That's a deliberately modest accounting," he said. "It's an accurate one," she said. He accepted that. He looked at his hands, the hands that she had watched in the trauma bay when the room was moving around her and she was still, the hands that had told her everything she needed to know in the language of someone who had learned to read that specific text. "The commendation is in the record," he said, "permanently. If you ever need someone to speak to it, professionally, institutionally, in any context, I'm available to do that." "I know," she said. "Thank you." She stood to leave. "Osei," he said. She turned. "The pharmacist at the forward operating base who taught you the QT correction formula." He paused. "Adeyemi mentioned it. I want to make sure someone knows that kind of education produces the kind of results that happened in this room. Those informal networks of knowledge, the things that get passed between people in difficult places, they're worth protecting." She thought about the pharmacist, about a dimly lit space in a building that had not been designed as a pharmacy, working from a formulary that was 3 editions out of date, who had taught her the correction formula on a Thursday afternoon when the patient load was briefly light, who had said, "You never know which piece of this you'll need at 2 in the morning a decade from now, so you might as well learn all of it." "His name was Sergeant Obi Azuka," she said. "He's out now. He runs an independent pharmacy in Columbus, Ohio. He's very good at his job." "Good," the Admiral said. And he meant it. She left the consultation room and walked the corridor of the 4th floor and took the stairs to the 3rd and walked the hallway to the nursing station and sat down at the desk and opened her notebook to a clean page. Outside the window, the Carver Bay coast had moved into the particular gray-blue of late autumn that preceded winter. The light thin and horizontal, the water flat and serious, the shore stripped of its summer population and returned to itself. It was not a beautiful view exactly. It was the honest view of a working coast, functional and unsentimental, which was the kind of view she had always preferred. She had a 22-year-old patient in room 14 who was due for a dressing change. She had a post-op patient in room 17 who had been asking questions the day team had been answering with efficient dismissal, which she had noted in the handoff chart and intended to address. She had a full shift ahead of her, routine and concrete in hers. She capped her pen and stood. The things she had learned, not in the Army, not in the forward operating base, not in the field manual. She wasn't supposed to have read, but slowly, over years, in the specific school of surviving things and continuing, was that nobody could see what you were capable of if you spent all your energy making yourself invisible. And nobody could protect what you were carrying if you spent all your energy making yourself visible. The balance between those two things was not a fixed point. It was a practice, a daily negotiation between the self you needed to protect and the world that occasionally, unexpectedly, desperately needed what you knew. She had spent 4 months becoming the nurse nobody noticed. She had spent one night being the person she actually was. The result was not that she had to choose between those two things going forward. The result was that she no longer had to pretend they were separate. She picked up the dressing cart and wheeled it down the hall to room 14, and she knocked on the door, and she went in, and she did her job. Outside, the gray water of Carver Bay moved in its quiet, indifferent way. The same water it had been the night the helicopter came down. The same water it would be next week and the week after, unchanged and unimpressed and carrying, in its particular saltwater cold, the complete absence of any interest in what a woman named Mara Osei had or hadn't done, or what anyone had or hadn't decided she was worth. Which was exactly right, because she had stopped needing the water to confirm it. She already knew. The people who are dismissed as invisible are not diminished by it. They are revealed by it, slowly, at the exact moment when it can no longer be prevented, in rooms full of people who suddenly realize that the quiet figure in the corner has been carrying something remarkable all along, not waiting for permission to use it, but simply waiting for the moment when using it was what the situation required. That moment always comes, and the people who have been preparing for it in silence, the ones who kept learning when no one was watching, who stayed in the room when they could have walked out, who did the necessary thing without needing the audience to understand what they were witnessing. Those people are never as unprepared as they looked.